If you have just undergone neck surgery and you woke up and have a hoarse voice, then you may have a paralyzed vocal cord. In this video, I will teach you and explain to you what a paralyzed vocal cord is, how it can be diagnosed, and how it can be treated. In order to have a paralyzed vocal cord or a non-working vocal cord, we must assume that there is an injury that occurred to the vocal cord nerve, which comes out of your brain down into your neck and curves back along the windpipe towards your voice box. Now, there are two vocal cords in our voice box, and when we breathe in, they are in an open position. When we talk, the vocal cords come together and they start vibrating, and they bounce off each other and give us our voice. If we have a paralyzed vocal cord, then one of the nerves is not working, and the information, the electrical pulse from the brain doesn't travel through the nerve to the vocal cord. So the paralyzed vocal cord will then be in a more open position. It will be more on the outside so that the other vocal cord cannot hit it and bounce off it to generate a sound. And that's where the voice oftentimes sounds very breathy. And patients are able to only talk, let's say, a 2 or 3 word sentence before they have to take another breath. It is fairly easy to diagnose a paralyzed vocal cord. We have small endoscopes. We can advance through the nose to visualize the vocal cords. Some of the injuries to the vocal cord nerve are temporary. Those would include a viral infection, but also stretch injury that can occur during surgery. The recovery may occur within 6 to 9 or 10 weeks or so, and the vocal cord then starts moving and the voice starts recovering. If you are one of those patients, then a vocal cord injection may just be what you need. These injections can easily be done in the office, and the material of choice in our practice is hyaluronic acid. This can easily be injected through the front of the neck, and we essentially inject the filler into the vocal cord to bulk it up, to push the vocal cord from a more open position to a closed position in a more phonatory position so that the other vocal cord can come into the middle and bounce against the paralyzed vocal cord. The breathing is typically not affected by these procedures. The downside is that the injectable usually dissolves within a few months, and hoarseness can return if the vocal cord has not recovered. Now, injections can be repeated a few times, but oftentimes, if we know that the vocal cord nerve will not recover, we typically recommend an open neck surgery called medialization thyroplasty. That is a procedure where we make a small incision in the neck on the involved side, and we then implant a small plastic piece, either Silastic or Gore-Tex, right next to the vocal cord to push the vocal cord over. These materials that we choose for the open neck surgery are permanent and will not be dissolved, giving a patient a strong voice that is very good for talking. After these procedures, patient will have a close to normal voice that will last them for the rest of their life.